breast cancer and plastic surgeon.
My name is Nicole Daoud, and I'm a physician assistant that works with Dr. Peled.
And we have a practice in San Francisco primarily based around breast cancer and breast reconstruction. And today I wanted to talk to Nicole about her role in our practice. So Nicole, to start, why don't you tell everyone what a PA is? What you do.
Sure. A PA is a physician assistant, and we are medical professionals who are generally trained, and we work usually in a collaborating team with a collaborating MD, or what we call a supervising MD. We diagnose illness, come up with treatment plans and management plans. We can write prescriptions, and in many cases have our own patient panels. But in the terms of our practice and in specialties, PAs I think have a really special and unique role in being able to kind of augment what the surgeon or the specialist already does.
So one of the reasons we're really excited to have Nicole in our practice is to help through both before, during, and after surgery, and really help our patients get the best outcomes and know exactly what they're going into and how to be best informed. So Nicole, can you talk a little bit about how you're involved for our breast cancer patients in their surgical journey?
From when the patient usually comes right into the door, Dr. Peled and I usually have like an augmented patient experience where Dr. Peled will go in, sometimes I'll go in depending on flow, and we can talk about preoperative things, and I go through different activity levels and what they can kind of expect as a patient expectation from whatever surgery that they're having, as well as post-operatively. I can also help intraoperatively as your first assist, which is really great. So kind of walking through a whole 360-degree view of what the patient experiences from the minute that they walk in our door and through their recovery.
And we are so excited to have Nicole as part of that journey, and I think one of the things that she's gotten more and more involved in is as we get women through their breast cancer treatment, then on the other side we have follow-up, and we're seeing people regularly to make sure that we're tracking and monitoring them. So Nicole, can you talk a little bit about, from a breast health standpoint, how you're involved in following our patients after they've gone through their breast cancer surgery?
In terms of like even just coming down and having their bandages taken down and talking through that process with them post-operatively, and just patient education, guiding them through the healing process, I think is really important. Setting expectations with patients about what they can realistically expect from a pain level, from an activity standpoint. A lot of our patients are our mothers and wives, and what they're actually doing in their activities of daily living, and getting back to health. I think talking about preventative medicine, preoperatively, but also talking about like recovery and health and fitness and exercise and spirituality all throughout their recovery is really important to me.
So for me, when I hear Nicole talk about that, I think that has been such a great thing about having her as an addition to our practice, that now we really have this comprehensive plan to get our patients both from breast cancer prevention, thinking about risk reduction, thinking about screening, to help all the way through breast cancer prevention surgery. So really grateful to have Nicole as a part of our breast health team.